Good afternoon, everybody. My name's Mary Hall. I'm one of the nurse practitioners from St Barnabas Hospice in Lincolnshire, and I've been asked to come along today to have a chat to you about advanced care plans. Working in a hospice, advanced care plans are part of our day-to-day responsibility and role. But it doesn't mean to say that they're easy, even as a healthcare professional. Sometimes it's a difficult conversation to have. The advanced care plan for me is all about that conversation. The conversation with an individual, with their family, with their carers. And it's asking that question, a few questions. What do you want to happen in the future? What do you not want to happen in the future? What would you want to happen, and how would we record it so that in the future, when you might not be able to communicate your wishes yourself, how would people know what you wanted to happen to you? This is something that does actually happen a lot, that we haven't given people an opportunity or supported people to be able to have this conversation. I think automatically everybody always assumes that when you talk about advanced care planning, that it's always about where does somebody want to be cared for? Where do they want to die? Have you thought about where would you want to die? For some people, and I think especially over the last 12 months with COVID, people's thoughts and wishes have changed about that, because what was important to people is that when they are dying, that they wanted to be surrounded by their family. And that wasn't always possible in COVID. So certainly in our line of work in hospice, we found that more and more people are actually choosing to die at home. But there are other opportunities for people to die in a hospice. Some people want to die in a care home. Some people want to die in a hospital. But without having that conversation, how can people support you to have that choice fulfilled? I think the other part of the advanced care planning is, I think sometimes the smaller details that people forget to have the conversation about, but actually they're really important. And I think they're really, really important, and probably more important, is that if you have a dog, if you have a cat, have you thought about what you would want to do after you're not there to look after them? Do you have a will? Have you organised a will? Is a will important to you? Have you looked at your financial affairs? Have you started to get things in place so that if you have family members that are there? What I've found through the advanced care conversations is that most people's main concern is about other people. They want to make sure that the people that they leave behind are looked after, that they don't have lots of administration to do. The only way you can do that, I think, is to start to plan, to start to think ahead, and to get these plans in place.